in a very unique position for not only being a respiratory therapist, but also being a salt therapy provider, and you have survived COVID-19, you and your family. You are in a very unique position for not only being a respiratory therapist, but also being a salt therapy provider, and you have survived COVID-19, you and your family, and you've been working on the front lines. So you really have a whole perspective of what's going on. So from your purview, there's a lot that you must be thinking about right now about and how this can work.
It's definitely, and you hit the nail in the head, because one part and then all of these other arrows repercussion, I'm feeling a little bit overwhelmed. I feel overwhelmed because, like you say, I'm experiencing from all angles. So it's like I'm trying to settle with what to think on this position, playing so many parts. It's like I'm playing so many parts, all regardless. And it's a little hard. And also we cannot forget the psychological aspect of the whole thing neither. So that's why I think even for the stress also, it's very stressful, very stressful. One reason why I want to come back to work in the front line as fast as I could, it is because of that. I figure that by coming back out there, trying to take my life back, I'm not letting the virus win. I'm doing everything. I did everything I could. That's why I immediately implemented the salt therapy, all sort of alternative stuff. Only 3 days of my 17 days of COVID crisis, I did not do salt therapy. Only 3 days. Those were the days that I was really, really bad. I was just gasping for air. I was doing nebulizer treatment every 3 hours. Other than that, I was just doing salt therapy regularly, sometimes twice a day. But I cut it like 30 minutes and then 30 minutes. When I didn't do 45 minutes a day, I did 30 minutes and then space it out what I could, where I was able to kind of be. On the front line, I see the devastation, and it's very detrimental. That's what I say. That I think that even after recovery, people may experience long-term effect on the lungs. It's something that we haven't seen. It's not just treating any typical pneumonia. It's not treating, you cannot use the regular settings on the ventilators that you use with some other issues that we are used to. So we just pretty much have to go with the flow. We do the best we can to really save the moment toward that person. Every individual is different also. What works for me might not work for other person. You know, I believe, I don't want to sound biased, but I believe that salt therapy really indeed helped me a lot.
Yeah.
And that's why we need to do other people, because I try to restrain myself a little bit, because people might say, oh, she owns the facility. And I don't want that, because I'm an honest person. And for the crisis, I don't think it's going to do much on the crisis. That's why when I was having the severe crisis, I didn't do the salt therapy, because you just need a bronchodilator and steroids at that point, right? But then preventative, also before I got sick, I used to do what I'll do between shift. I used to go to work, I used to take my vitamins, do my salt therapy either before I went to work, the night before if I was going to start at 6:30, and then I did heavily every day when I was sick.